The TRISS Trial. Welcome to today's episode of the Everything Surgery podcast, where we dissect the extraordinary. In this segment, we explore the pivotal TRISS Trial, formerly known as the transfusion strategies in patients with septic shock. Let us begin by framing the central question addressed by the TRISS Trial. Historically, physicians caring for critically ill patients with septic shock often transfused blood at a higher hemoglobin threshold, around 9 grams per deciliter, based on the assumption that this would enhance oxygen delivery to tissues. However, blood transfusions are not without risk. Complications such as infections, lung injury, and circulatory overload are well documented. The TRISS trial was designed to determine whether a more restrictive transfusion strategy, using a lower hemoglobin threshold of 7 grams per deciliter, could be just as safe and effective as this liberal approach. This landmark study enrolled 998 adult patients admitted to intensive care units across Scandinavia with septic shock and hemoglobin levels of 9 grams per deciliter or lower. Participants were randomly assigned to one of two groups: a restrictive group, where transfusions were given only when hemoglobin fell to 7 grams per deciliter or less, aiming to maintain levels between 7 and 9 grams per deciliter, and a liberal group, where transfusions were administered when hemoglobin dropped to 9 grams per deciliter or less, with a target range between 9 and 11 grams per deciliter. The primary outcome measured was death from any cause within 90 days of enrollment. The results, published in 2014, revealed no statistically significant difference in 90-day mortality between the two strategies. In the restrictive group, 43% of patients died, while in the liberal group, 45% died. Other important outcomes, such as the rate of ischemic events, including heart attacks and bowel ischemia, the need for life support measures like mechanical ventilation and vasopressors, and the occurrence of serious adverse reactions, were also similar between both groups. In conclusion, the TRISS trial provided robust evidence that employing a restrictive transfusion strategy, with a hemoglobin threshold of 7 grams per deciliter, is as safe as the more liberal strategy for patients with septic shock. For the majority of stable patients in this category, there is no advantage in transfusing to maintain hemoglobin levels above 9 grams per deciliter. Opting for the lower threshold not only avoids unnecessary costs but also reduces potential risks associated with blood transfusions. Importantly, the findings from the TRISS trial have been integrated into major international guidelines, such as the Surviving Sepsis Campaign, and have helped standardize a more conservative, evidence-based approach to transfusion in critically ill patients with septic shock. Thank you for joining us. If you enjoy our content, please like, share, and subscribe. This is the Everything Surgery podcast, where we continue to dissect the extraordinary.